Evidence suggests that trauma changes the way the brain works. An overactive amygdala can heighten someone's response to emotional stimuli, including fear. I think we should consider amygdala ablation for Ben.
That's crazy and completely outside the scope of our care. We're surgeons. We fix physiological problems, not mental ones.
It is a physiological problem. His brain isn't functioning properly. If it was a tumor that was causing these reactions, you wouldn't hesitate to remove it.
But there is no tumor. You're talking about inflicting damage on his brain. He could suffer a stroke or come out in a coma or not come out at all.
If you use a stereotactic laser approach rather than an open craniotomy, you would greatly reduce the risks.
This is not your case. You cannot jump into this one because you don't want to do the one assigned to you, which is to teach, which you've made my problem just like you made Leah's birthday gifts my problem. You need to grow up and accept some responsibility. Ben, no one is going to hurt you. You're having a flashback.
I know where I am. Every day since I came home, I felt like there's a monster chasing me. I try to outrun it, but I end up hurting the one I love the most. I'm a threat to everyone around me.
No, Ben, you just need help.
Nothing helps. I can't smile, I can't laugh, I can't feel anything but pain. I make everyone around me suffer.
Ben, there's a surgery that may help.
I would like to scrub in on the amygdala ablation surgery. Rose said you're feeling overwhelmed.
I don't want to hear any more things that woman has said. Your job is to supervise your residents. Why are you here instead of doing that?
You said you were going to supervise my supervision, but you didn't. You took over my case. I don't know what I was supposed to learn or how.
Scrub in. Dr. Murphy, walk Asher through the probe placement and trajectory to the amygdala. I will supervise your supervision.
Okay, insert the probe perpendicular to the cortical surface. Stop! You're off course. On the current trajectory, you will penetrate a branch of the choroidal artery and cause a hemorrhage. Step away from the probe.
Your job is to teach, not take over.
Adjust the probe 1 millimeter inferiorly. Avoid the temporal horn on your right.
I can't see it on the image guidance.
Tell Asher what you see.
It should point toward your 6 o'clock on the y-axis. You have to feel it. The tissue plane along the parenchyma is smooth. It should feel like gliding. You've reached the amygdala.
Ready to begin thermal laser ablation.
Need another
6-0 loaded backhand for the arterial stump.
Graft is secure.
Take off the Satinsky clamp. Good perfusion to his lower body.
Heart rate spiking.
There's no ST elevations.
BP's tanking. Did he thrombose the graft?
Distal anastomosis is pulsatile, but there is blood pooling in the left lower quadrant.
The right too.
Oh, he's bleeding everywhere but the graft.
It's DIC.
Send a stat rotum and coag profile. Start compressions, give epinephrine, and get the defib.
Set it to 120.
120. Clear.
Compressions?
No response. Go to monophasic at 360.
Clear. Why aren't you shocking again?
He's in asystole. Dr. Lim? Dr. Walk. He's dead.
Time of death, 7:23 p.m. Take as much time as you need.
He died. I tried stepping back. I tried brainstorming. And he died. I don't know what people are thinking or feeling. I can't communicate what I need. And more patients will die.
You don't think your ASD had anything to do with your patient's death, do you? Because it didn't.
It did. Asher wasn't sure about his abdominal exam. I should have known that.
Shaun, you're gonna do most things better than anyone else. And there are days when you're gonna fail like everyone else. Today might be one of those days.
So, what do you do then?
You go home, you be with the people you love. You take comfort in that, and then you wake up tomorrow and start all over again.
You can go home.
I just don't want to be alone right now.